Thank you. Good afternoon, ladies and gentlemen. My name is Margaret Kushner, and I'm here representing Women Occupy San Diego and our proposal to change the Citizens Review Board to the county model. This proposal was brought to the Committee on Charter Review and passed on to you because it's not clear that charter review will be necessary to effectuate a proposal such as this. The 4 points of our proposal are, one, that independent investigators and subpoena power be provided as it is in the San Diego County Law Enforcement Review Board, which was passed by the voters in 1990. Also, that intake, tracking, and review of all complaints filed is done by the CRB rather than the San Diego Police Department Internal Affairs section. This would also be modeled after the county Law Enforcement Review Board, which covers the entire county, 9 contract cities, the Sheriff's Department, and the Probation Department. Thirdly, we'd like to suggest that the name be changed to the Citizens Review Board from the Citizens Review Board to the Community Review Board, and that would reflect a broader representation from the community, and that the members be appointed by the 9 council members, 2 per district, and 1 appointee by the mayor. We feel that the benefits of this proposal would be for both the citizenry and the police department to increase trust, because there is nothing as priceless as trust. And as we know in this country today, that is a matter of grave concern. Thank you very much for your interest.
We will go then to our information agenda, beginning with information on the PERT program, the psychological emergency system that is in place, teaming officers with trained psychologists to help with mental health issues, people who are mentally disturbed, emotionally disturbed. And I want to say congratulations. The county's new budget included, I understand, about $1.6 million extra so that we can put more of these teams on the street. So congratulations, and thank you for what you do with that. How long you think you're going to be?
5 minutes.
Terrific. And if you'd identify yourselves for the record, the floor is yours.
Good afternoon, Chair Emerald and other distinguished members of the Public Safety and Livable Neighborhoods. I'm Debbie Farah, and I'm the lieutenant overseeing the Psychiatric Emergency Response Team and the HOT team. Today I'll be updating you on our PERT teams, our increase in calls for services, and how we are addressing this with additional training of our PERT teams. But first, I'd like to introduce the new director of PERT, Dr. Mark Marvin.
Thank you. I really appreciate the opportunity to be here today. I'll just give you a basic general overview because I'm assuming you know a little bit about PERT. Basically, our mission is to provide compassionate services out there in the community, and what we do is we partner trained law enforcement officers and PERT clinicians out there. With the just ended fiscal year, I'm happy to say that we provided about 1,000 more contacts than the previous years. So we did about a little over 16,000 PERT contacts out in the communities with folks living with severe and persistent mental illness, as well as their family members. So basically, what we try to look at when there is a call into dispatch that involves a law enforcement issue where it's thought that perhaps a psychiatric crisis is also at hand, the team approaches the person out in the community. The officer basically assesses for safety, and then the PERT clinician basically does their magic and does basically an assessment to talk to the person. The belief is that by doing this, we can avoid perhaps a de-escalation if someone has an issue or a trigger with seeing someone in uniform. We oftentimes do have to do a 5150 certification, which is a transport to a facility to determine possible involuntary detainment. But usually that only happens around 20% of the time. Typically what we can do is our clinician and the officer can talk to the person and maybe kind of triage their situation and talk them into maybe getting back into their mental health center maybe making an appointment with their psychiatrist, or just kind of working through the issue if they're having struggles with their roommate, if they're living in an SRO downtown, for instance. So that's really the main goal of PERT right there. We are system-wide around the county. Our law enforcement partners, including the Sheriff's Department, obviously San Diego Police, and other local police agencies, we work hand in hand with each other. The difference is here in San Diego County compared to other counties where we have PERT similar programs is that we're actually cross-jurisdictional. So what that means, conceivably, there could be an issue, say, down in National City Police Department's jurisdiction, but maybe there's not a PERT team available. A team from the San Diego Police Department would go down and respond to that situation. So that's one very unique feature of our teams. The other thing that happens is we really are striving to allow the resources of the police department to respond to law enforcement issues in general. So the thought is that by having the PERT teams there, the PERT clinician with the expertise that they have can do the little deeper dive and maybe a quick way of assessing the situation, and then that frees up other officers out in the department, as well as the team can then move on to the next case. One thing that we do to assist all law enforcement officers is through PERT, we keep track of waiting times at the various hospitals when officers have to make a transport for a possible detainment. And I'm happy to say that with some of the facilities, we've been able to reduce the time massively. Just as one example, CMH, otherwise the EPU, traditionally has had around a 55-minute waiting time for law enforcement, and that really ties up resources in the community. By PERT and our community partners and mental health services working together, recently they've been able to decrease that down to about a half an hour. So that's extremely significant. And we're working with basically every hospital in the county to assist our law enforcement partners. One of our flagships of PERT happens to be our training. So in addition to the teams going out in the community, we have what we call the Regional PERT Academy, which is a 3-day event wherein officers and dispatchers are given information about mental health. Unfortunately, in our society, most of us learn about mental health issues through, depending upon which Jack Nicholson films we watch or what films we saw at the drive-in when we were teenagers, right? So a lot of what we do is try to break down myths. And we don't make it too academic or with a lot of psychobabble, but we do introduce the officers to what are psychotic disorders, for some basic recognition, and most importantly, how to interact with someone. We also talk about major mood disorders, suicide potential, developmental disorders such as mental retardation, cognitive disorders such as Alzheimer's disease. And we are thankfully receiving very nice feedback after the trainings when the officers are out in the field to assist people. The other issue that we have which is very important to us, is our partnership with NAMI, National Alliance on Mental Illness. And so I really want to put out there that it's not just dealing with that person who is living with the mental illness, but everyone out there is impacted, family members as well. And so we do participate in community panels. We do a lot of community events out there with NAMI. At this point, I guess I'll turn it over to the lieutenant.
As Dr. Marvin stated, we team licensed mental health clinicians with uniformed police officers to respond to the mental health crisis. We currently have 23 clinicians countywide, and they staff 10 PERT clinicians, PERT teams in the city of San Diego. The goal is to provide effective and compassionate crisis intervention to individuals living with mental illness who come into contact with law enforcement officers, and to provide them linkage to appropriate levels of service. Through our MHSA funding, PERT will be able to staff an additional 10 PERT teams countywide. That's great news. And we'll also be increasing the training days from 22 to 45. And why is PERT and mental health so important for our first responders? Well, as we know, 1 in 4 people will experience mental health issues within their lifetime. 1 in 17 will have serious mental illness. And law enforcement is often the first responders to respond to a mental health crisis. If your loved one is having a mental health emergency and they call their medical provider, The recording's going to say, this is a medical or psychiatric emergency, please hang up and dial 911. And having those PERT trained officers, they've learned de-escalation techniques that can calm someone in that agitated state. The San Diego Police Department has seen a huge increase in mental health calls since 2008. As you can see, we received 8,988 calls in 2008 and 16,100 in 2014, and we are on pace to exceed 17,000 calls in 2015. The majority calls from service come from Central Division, which is 24%, followed by Western at 15% and Mid-City at 13%. Regardless of the call for services, these percentages stay consistent. These calls are for suicidal people, concerned family members, a report of someone acting out, or a person living with mental illness who is calling for themselves. Having a first responder that is familiar with resources can provide great tools to families dealing with loved ones with mental illness. It's important to look at more than just the numbers. Each one of these calls is a crisis. According to the County of San Diego Department of Medical Examiners, 441 individuals died as a result of suicide in 2013 in the County of San Diego. The numbers for 2014 are not out yet. Our goal is to reach people in crisis before it gets to that point. Our message is to call before the crisis. The public can go for additional resources either at the website of uptosandiego.org or call the crisis line at 1-888-724-7240. Thank you.
And thank you for what you do, and thank you. Welcome to San Diego.
Thank you very much.
I also want to just put out the thanks specifically to the two county supervisors who really pushed for a study of PERT and your needs and pushed for the extra money that has gotten into the budget. That would be Supervisor Dave Roberts and Diane Jacobs. So they were real leaders on that. Let's go to members of our committee. Mr. Gloria is on the lights.
Thank you, Ms. Emerald. No public commenters on this one? Oh, okay, very good. Well, Debbie and Mark, thank you very much for the presentation. Big fan of PERT and the work that's done. I'd heard tell of some enhancements to the program, which is great to hear, certainly given the numbers that you're showing. And I guess I wanted to start there. Any sense of why the tremendous increase in the number of calls over the last number of years?
Well, there might be a couple factors for that. One is, I believe the county mental health services is really overtaxed. And sometimes what happens is a PERT team will have an intervention with somebody, and they might go into a hospital, be it voluntarily or involuntarily. And then when they're released, there's a difficulty of getting into a clinic in a timely manner where they will maintain that treatment relationship. And so they tend to drop off, especially around in the downtown area. And so unfortunately for many, it tends to be a revolving door. So that's an issue that comes up at meetings in the county. This has especially come up with children in recent months in terms of having adequate services actually in the hospital, and then once they're released, to get the follow-up care. So I think that's one big perspective from my perspective. Want to add?
Oh, that's great.
So revolving. So in terms of these are not unique individuals. There are many frequent flyers, if you will.
Yes. One of the things we pride ourselves on, actually, to kind of combat that is the buzz phrase. It's all in the relationship. So my hope is that as we're out there, we develop relationships with these folks who are living with the mental illness, as well as the family members, and so we don't have to reinvent the wheel. And our clinicians do have access to the county electronic medical record, ANASAZI. And so as we're looking up their information while we're en route, we can see what the recent activity has been, where they're getting services, and so we can actually try to advocate on behalf of that person that the clinic out there kind of, you might say, kind of ushers them to the front of the line if need be to get them in at least for a crisis appointment. So we're trying to look at it from different directions. Hopefully that the folks out there, especially with some of the more psychotic disorders, involving, say, paranoid persecutory delusions, that they will recognize the PERT team and feel at least a sense of comfort where we can encourage them to maintain treatment compliance.
So, Mark, can you tell me, so of the 4,200 almost calls in the first 3 months of this year. How many of those were unique? I mean, is that 300 people calling a whole lot, or is that? Do you have a?
It might involve repeat people, but there are also many first-timers. It might also include family members.
Okay.
So we kind of look at them. It sounds like a cliche, but I believe it's true. They're all kind of unique in their own way. We are trying to do that deeper dive to try to figure out how to get people more connected, utilizing our partners, NAMI, utilizing the different law enforcement agencies to recognize certain people.
One of our partners is here today, Dr. Dunford from the EMS, and one of the reasons he's here is because we were actually, one of those clinicians is slotted, hopefully, we're having our meeting in a couple weeks, to go as a community paramedic. So the response will be for the people that are voluntarily wanting to get help, rather than having a police officer with a badge and a gun show up at that call. It would be with a community paramedic along with the clinician. So it would be a pilot program that we're having, and hopefully that'll be taking away some of those calls that police officers don't necessarily need to respond to that the community paramedics could. So it's a really challenging program.
I'll be interested to know if you had the data available, how many of those are unique, or I mean, for if it's a family, what have you. I mean, I'm not looking for an explanation. I'm just looking for the number.
Yeah, I could look into that and get back to you.
I would be curious. And along those lines, does PERT have any performance indicators? I mean, is there something that we should be looking at to see how successful or not the program is?
Yes, we have productivity goals, basically. We break it down into crisis intervention units as well as, you might say, more community service, kind of referral to resources, two different types. Mm-hmm. So, and that's something we keep track of with our clinicians. And actually, we are also working with the various commands, the law enforcement agencies, including San Diego Police, to see how we can more efficiently use the officers' time and the PERT clinicians' time and how those units are responding. And I'm really pleased to say that the cooperation with not only the PERT clinicians but our law enforcement officers, when we look at the data and see that there's more likely calls during these hours compared to the hours that maybe they were doing their shift, they will both voluntarily recommend to change their shift to reflect where the action is. And that's really something. So we look at those factors as well.
Well, I think maybe my previous question and that one sort of intertwine, to trying to understand what success is for a program like PERT. I mean, I imagine sort of anecdotally what that may be. If you have repeat offenders that are, consuming much of your resources, maybe there's some different, I don't know enough to be dangerous on this, so I recognize that this is, you can be like, what the hell are you talking about? You don't know what you're talking about. So feel free to share that if it's what you believe. But understanding how difficult mental health is, understanding how few resources we have, even acknowledging what more you're getting, and seeing the trend line on at least the gross numbers. I don't know what those are in terms of individual users, but whether you're having a substantial mental health crisis in the community, or you're just having people inefficiently overuse the system as sort of frequent flyers. Either way, I don't think that that overall number is not headed in the right direction. And unless you're willing to make the comment today that we have people just going nuts in this city right now, something tells me that I'd like to know more about how this program is, what success looks like, and how those measurements are done. The last question would be, last week we had an assault on two of our city's firefighters.
Yes.
Do we know if the assailant in that particular case had ever accessed PERT?
My understanding is no, that person had not.
And then, I said lastly, but one more question. We'll put my budget committee chair hat on. I noted that there's no fiscal impacts noted in the staff report that came with this, but obviously there are San Diego police officers that are involved. Can you explain, I don't know if that's for you, Debbie, why no fiscal impact despite our involvement in the program? Is it that we don't make a direct contribution? It's just in kind in terms of the officer's time? Is that
right? We would be responding to the calls regardless of whether we had the PERT clinician in our car. It's just that having the PERT clinician in our car gives us an extra resource to deal with it.
Interesting. Well, I only ask that because I believe the city has a tremendous commitment to this program, and I think it's obviously you're doing work. I'd love to see that somehow quantified and reflected. It seems to me that it really is it's a dynamic duo, right? It's the combination. A clinician by themselves or an officer by themselves, yes. You wouldn't be getting hopefully the outcomes. Again, I'm looking for more information on that you'd want, and I don't want the public to not see us putting what isn't our line of work when you know you really mean it is when you're dedicating dollars to it. And I recognize those are dollars you're going to spend either way, but I'd love to see that quantified so we can at least show the county that we have some skin in the game where this is concerned.
Absolutely.
Thank you, Ms. Emerald.
You bet. Mr. Kate.
Thank you, Madam Chair. And furthering the wonk out here on the data, I second Mr. Gloria's comments in terms of the unique calls and as well, too, I don't know how far back you can take that, but how that's trending, and also and kind of that measuring of success or whatnot is determining what other agencies or regions are they on that similar path, and if not, if they're trending in a different direction, what is success like to them, and what can we emulate of sorts in terms of programs or funding or whatnot to determine those their success. I mean, have you seen similar trending in other regions as well, too?
I can speak just to San Diego County.
Okay.
San Diego County's numbers reflect what the city numbers look like, so that's very similar numbers.
Okay, perfect. Well, I, again, second Mr. Gloria's comments on the data, and would love to see it as well. Thank you.
Thank you.
Yeah, perhaps early this next year we can get a report back on some of those figures to see where we're going and perhaps where we might need to put more resources. Is there anything else either of you would like to add?
Well, thank you for your support.
Yeah, we appreciate it immensely. One thing I probably should say is that we are earmarking one of the positions for San Diego City Schools. So that's also a nice twist, too, for us.
That's excellent, yeah, because we know that mental health issues don't just pop up one day when you're walking down the street, that sometimes they're brewing when our kids are coming up through grade school, middle school. Many children are dealing with trauma. And I know our school district is working very hard. The city's working hard to reach out to those youngsters.